Hi, Siddarth here. So today, let's speak about a topic that is very important but not usually spoken about. It is PCOS, polycystic ovarian syndrome. It is estimated that up to 25% or close to 30% of women in the reproductive age group are struggling from different symptoms of PCOS. Of these, around 80% are overweight. It is considered a lifelong disease with enormous medical, if emotional and financial consequences. Just to give you an example, women suffering from PCOS are at a much higher risk for developing other ailments like type 2 diabetes, cardiovascular issues, etc. Just imagine millions of women struggling with all these issues, living very suboptimal lives. Our friends, our wives, sisters, neighbors, struggling with these problems every day. And given the cultural scenario in our country, they're not even able to speak about these openly. So how do we define PCOS? PCOS, the S stands for a syndrome, which means it's a collection of symptoms. So a few years back, there was a kind of an agreement on what symptoms will constitute PCOS officially. So these symptoms are delayed or no ovulation, which leads to irregular or missed periods. Usually, if the duration of the periods is more than 35 days, or less than 10 periods in a year, it is considered to be PCOS. The next is known as hyperandrogenism, which in simple words means more than the normal level of male hormones. Androgens are male hormones, which lead to symptoms like hair growth on the face or other parts of the body, and male type baldness, losing hair from the top of your head. Also, acne. And obviously, last but not the least, the main symptom, which is polycystic ovaries, the appearance of cysts in the ovaries if you do a ultrasound. So these are the three main symptoms which characterize PCOS. But there are many other symptoms associated with PCOS like weight gain, painful periods, hot flashes, mood swings, increased likelihood of getting type 2 diabetes, cardiovascular issues, cholesterol imbalances, high blood pressure, fibroids, even the likelihood of getting thyroid related issues is much higher. Unfortunately, these women are normally handed pretty poor advice. So the first thing that is told to these 80% of women who are overweight is you just need to lose some weight. All these problems will go away. What is happening is a part of the problem is being presented as the root cause. That weight gain is the cause of these problems. No, weight gain is a part of the problem. And another very frequent thing is to give or to prescribe birth control pills or other contraceptives, essentially hormone replacement therapy. So, and you will get your periods, right? Please understand that these are unnatural periods. You are forcing the body to shed the lining in the uterus. This does nothing at all to solve the actual problem. Now let us look at the root causes of PCOS when we approach the problem using the functional medicine lens. The first is inflammation. Chronic, systemic, low-grade inflammation is a basic contributor to PCOS dynamics. The next is insulin resistance. Insulin resistance not only creates some of the problems associated with PCOS, it also aggravates other factors, other drivers of PCOS. For example, insulin resistance always aggravates inflammation. It will also cause the increase in the production of the male hormones, hyperandrogenism. The next is estrogen dominance. Almost always it is found that women with PCOS have higher than normal levels of estrogen. This is also driving one of the most well-known symptoms of PCOS, which is polycystic ovaries, the cysts in the ovaries. Hypothyroidism is the next most common cause for PCOS related dynamics. It causes or aggravates almost everything connected to PCOS. It causes larger ovaries, it aggravates the cyst in the ovaries, hair fall, obesity, mood swings, low energy, increased male hormones. Adrenal imbalance is a little known but a very deeply connected causative factor of PCOS. The signature symptom of PCOS is the increase in the male hormones, leading to issues like hair growth, hair fall, acne, irregular or missed periods, complete stoppage of ovulation. So where these male hormones are produced? More than 50% of them are produced by the adrenal glands. Stress, perhaps the most ubiquitous but least acknowledged and least addressed factor in most chronic ailments, including PCOS. Stress can single handedly create inflammation, cause insulin resistance, affect the functioning of the thyroid, leading to hypothyroidism, and also impact the functioning of the adrenal glands, etc. etc. Okay, so just one thing in your life can create so many problems. I hope this video has given you some useful and interesting insights into what are the true causes behind PCOS. In the next few videos, we will look at each of these drivers, the causes of PCOS, and also understand how we can address those causes, helping us thereby to reverse the dynamics of PCOS. Take care and see you soon.